Hello and welcome everyone to another episode of MedSynapse podcast series. I'm your host, Hetvi Shah, and today we are diving into an exciting evolution in orthopedic care, which is same-day discharge and total hip replacement surgery, a game changer in joint replacement protocols. And joining us once again is the brilliant Dr. Veenesh Selvaratnam, consultant orthopedic and hip and knee surgeon. He practices privately at University of Malaya. He's a specialist center and serves in the government sector of University Malaya Medical Center in Kuala Lumpur. Dr. Vinesh is trained in Liverpool. You completed prestigious fellowships across Europe, including Brinton Pelvic Hip and Knee Unit, the Avon Orthopedic Center in Bristol, and the Exeter Knee Reconstruction Unit. He's a certified robotic hip and knee replacement surgeon and was selected for the Effort Robotic Traveling Fellowship across Germany, France, and the UK. So, Dr. Vinesh, always a pleasure to have you back with us today, and welcome back to the show.
Thank you, and thank you for the kind introduction.
So, Doctor, let's just get right into our topic. So, could you walk us through the concept of the same-day discharge and total hip replacement evolved, and what drove its acceptance in modern orthopedic surgery?
Okay, so I'll just give you a brief history on DK same day discharge arthroplasty, including hip and knee. As you suggested, or as you told earlier on, I was actually trained in the UK, so I was there for 18 years actually in the UK. So that's where I actually first started doing daycare, same day discharge, hip replacements and knee replacements. And I came back to Malaysia about 5 years ago, and I've been doing daycare, same day discharge, knee replacement for more than 2 years now in my center. And I actually did the first ever daycare total hip replacement, daycare same day discharge total hip replacement last month in May, and that was the first actually done in Malaysia. So we brought in this concept due to a variety of reasons. I think the first thing is because our waiting time for inpatients, so regular waiting time for knee replacement and hip replacement is quite long on a regular inpatient waiting time. So patients who actually fit and who actually live nearby and who are actually got good family support, and patients who are keen to go home. Some patients do not like hospital and they rather have their surgery and go home on the same day itself. So this patients are very suitable for this daycare same day discharge, and it has evolved. So I think our surgical techniques are much better. Our the way the anesthetists they perform the procedures or they give the analgesia is much better. We got good nerve blocks as well, and all this has helped us actually from patients staying in hospital after arthroplasty surgery for three to 5 days post-operatively, and patients are able to go home the same day, really.
Yeah, that's interesting. And I think that's a great overview, doctor. And I think it is so fascinating to see that how the focus is actually shifted towards patient-centric efficiency. So now, doctor, what perioperative protocols or enhanced recovery pathways have proven most effective in facilitating same-day discharge?
So, I mean, the thing is that I think the most important thing is actually patient selection, and I think you need to get good patients. So, I've been if you don't get a correct patient, a very motivated patient, and you don't get a patient who have got good family support, then I think these are patients you can't really do daycare same day discharge. So I think the most important is patient education. So you need to counsel. So when I see a patient, I'll see whether it's suitable for a daycare surgery. So depending on the patient's home circumstances, depending on whether patients are motivated. And I said earlier on, some patients do not like to stay in hospital. So these are the ideal patients, really. And with regards to what we do pre-operatively is we see them, we counsel them, we send them for some physiotherapy, for some rehabilitation, and they're also seen by the anesthetist to make sure that these patients are suitable or they're fit enough to go home on the same day itself. And the thing is that, I mean, with the same day discharge, I don't know whether I've told you earlier on, patients essentially they come in the same day of the operation. So they present to hospital, to our daycare center at about 7:30 in the morning. they're again seen by the anesthetist, again seen by the surgical team. We start our surgery at about 9 o'clock. We finish it at about 10:30 or so. And these patients, they actually get a spinal anesthetic for hip replacement, including knee replacement as well. And for hip replacement, our anesthetist gives them a periarticular nerve block. So it's a kind of nerve block under ultrasound guidance to help with their pain relief. And they have a spinal anesthetic. We try and avoid a general anesthetic, and we avoid any medications that give them side effects like nausea, vomiting, and then they have the surgery. So surgery is completed by about 10:30 or so, and about 6 hours after the spinal anesthetic, patients get walking. So they start walking about 2:30 in the afternoon with the help of the physiotherapist, and they're home by about 4:30, 5 o'clock in the evening. And we give simple analgesic. I mean, the analgesia they go home with things like paracetamol, tramadol, Celebrex, as long as they're not allergic to it. And then the next day we give them aspirin just to prevent clots. So it's a venous thromboembolic prophylaxis, really. So with regards to what we do special, I mean, there's not much really special preoperatively. So as long as patient selection is good, they're fit for it, and patients are up for it, and as long as they do not have any very significant deformity of their hip, so we do it for standard hip osteoarthritis, not the post-traumatic where they need a lot of work doing. So obviously those kind of patients will have a more prolonged surgical time. They'll need observation. They'll have more blood loss. So these cases are just simple primary hip osteoarthritis, really.
Correct. I think it is the interesting and impressive to see how multidisciplinary coordination, right from anesthesia to physiotherapy, can actually influence outcomes so strongly.
Exactly.
So now, doctor, how do you ensure post-discharge care and early complication detection in the same day setting? And is there a protocol for virtual or home-based follow-up as well?
So this is very new to Malaysia, really. So not many centers. I mean, for hips, no one does it except us. So the thing is that, I mean, to be honest with you, what we do is that when patients go home, I normally give out my phone numbers, even though for all my patients, I give out my phone numbers to them who come in for daycare, just in case they got any problems, they can call me. Because as you can imagine, they had a big surgery done, and there's some anxiety among patients and the family members as well. So I give them my phone number, so they got some kind of reassurance. I think that helps patients and their family a lot as well. And obviously, when we discharge them, we just don't discharge them and never see them. We see our patients about 2 days after the surgery in our clinic, just to make sure the wound is fine and they do not have any problems. And normally by then, patients are very, very well. They're already mobilizing with a frame. I think the patients are obviously mobilizing in hospital itself before they go home. But after about a day or two, they're much better as well. So we don't really have something really structural. But I mean, this is all evolving. This is something new in countries like Malaysia. We're still developing the services, really. So that's about it, really.
Yeah, I think also some reassurance is always needed for patients, and it's really interesting to know that you do it on personal level. So it's
Yeah.
really fascinating to know, actually. So, Dr. Naidu, in what ways has daycare THR impacted hospital resource utilization, like and surgical throughput, and even cost effectiveness for that matter, especially in high volume centers?
Yeah, so I mean, I work in a big university hospital. I mean, it's University Malaya Medical Center and University Malaya Specialist Center, which is our private wing. I mean, we have got a very, very good support and very good multidisciplinary team. The thing is that how this helped us is, as I said, our waiting time is a long time for inpatients. So, I mean, these are set up to reduce our waiting time. And obviously, with inpatients, so when patients come into the government side in University Malaya Medical Center, so obviously, if patients have it under daycare setting, it'll be much cheaper because you don't have to pay for inpatient cost. And so this will obviously, and it has actually reduced our cost, and also it's helped us utilize our daycare theaters, because we got a specialized a daycare theater with the daycare team and daycare recovery. And the most fascinating part is that these patients, they're not even admitted a single second to the ward, so they don't even see our inpatient wards. The whole process occurs in our theater unit, really, in our daycare theater unit, which I think in the future, I mean, it has revolutionized our practice, but with time, it will revolutionize our joint care, hip and knee replacement in the whole of Malaysia, which we are trying to set an example or set a model for daycare, same day discharge, arthroplasty surgery. And with regards to our efficiency, I think by doing more and more of these cases, it will help patients as well, especially some patients who are keen to go home. Some patients do not need to stay in hospital as well, because this, whether you go home or whether you stay in hospital, the analgesia or the pain relief you get is exactly the same, really. And I think if patients undergo a daycare procedure, I think the anesthetist itself, or we try and get the pain control much better as well, because we have got we need to get them to have a good pain relief before they go home. So I think daycare is the way forward in selected patients. Not all patients suitable for it. So patients who are suitable for it, I think is the way forward.
Yeah, I think it will be better in future also, right? Like it will just revolutionize more if I'm not wrong.
That's right. Yeah, exactly right. So I think with time, patients will start accepting it, because once they
Mm,
have it done, they'll look at it. Oh, my friend had it done, and they were well. I want the same thing. And this
yes.
we're doing it for the last 2 years, especially in knees now. And now we've brought it over to the hips. So in knees, oh, my friend had it, my neighbor had it. So I don't want to stay in hospital, and I want to get it done. And I think as long as you got a good team, you got a good theatre
Right.
team, you got good anesthetic team, you got a good physiotherapy team, good hospital management, and that's what we have got. We've got amazing hospital management. We've got a good joint replacement unit team as well in our center. So this all helps with our program, actually, our daycare same day discharge joint replacement program.
Yeah, I think that's really interesting to know, Doctor. So finally, Doctor, what innovations do you think that will accelerate this trend more?
So I think there are a lot of innovation. I mean, so first of all, I think as I said, with regards to a good working team, so you got a good multidisciplinary team. I think that is very important. You need a good surgeon who's doing it. So a surgeon who can do this kind of procedure, who are trained to it, trained to do this kind of procedures, who are subspecialized in joint replacement surgery. And also there are other things as well, such as robotic services have come up. I mean, my most of my knee replacements, daycare, all robotic. But the hip that I did as the first ever in Malaysia last month, it was a standard conventional hip replacement without the robot, and also with standard implants and via a posterior approach, which is a commonly done approach. And so I think they are technological advancement, but I think at the end of the day, a lot of things is what you're trained at and what you're good at, and patient safety as well. So that's about it, really.
I think it sounds like we're on a very nice shift where robotic precision and streamlined pathways actually is making the new norm. I would say the daycare as the new norm. So it's really interesting to hear that.
Yeah, so I think robot is there to help the surgeons. I mean, robot is not going to
Hmm.
do the surgery, but it just helps
Correct.
the planning of the surgical intervention, and just to. It's not a bad thing; it's a good thing.
Okay.
But I think ultimately, it's still the surgeon, the patient, and your team.
Hmm. So it's gonna be just making the surgeon's life easier rather.
Yes, it actually does, actually, for especially for preoperative planning. So always we still plan even without the robot, we still do a lot of preoperative planning. But I think with the robot, it will help with planning. But I think with regards to daycare, same day discharge, hip replacement, it's still patient, it's your team, it's the surgical
Correct.
surgeon. and whether you got a good enough setup to do it really. So you can't really do it if you work in a very small place we don't have a multidisciplinary team. And the good thing is we have got our patient volume is high, so we got a good amount of patient selection as well. And I think once this gets out, more and more patients will opt for this.
Mhm. I think awareness is really important, and as you also mentioned, that multidisciplinary team is actually very pivotal, and it makes a huge difference also.
Of
So,
course.
Dr. Vinesh, thank you once again for sharing your insights and such a valuable part of our MedSynapse series. And I think these advancements truly reflect where the future of orthopedics is heading. So, thank you so much for sharing that with us.
No problem. Thanks a lot. Thanks for your time.
And to our listeners, if you found this episode helpful, do not forget to tune into more such insightful discussions. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay informed and stay curious.